Welcome to Healthcare Sucks. Just a couple quick updates that happened just tonight. I want to get to you. Listen to this.
Ontario. The World Health Organization is clarifying its recommendations on the use of a popular anti-inflammatory medication. The agency says people who suspect they have COVID-19 should not take ibuprofen, commonly sold as Advil or Motrin. Instead, they should take paracetamol, also known as acetaminophen or Tylenol, if they're experiencing pain. The WHO says it's still looking into the impact of ibuprofen, but there's concern it may make COVID-19 worse. Those already taking the drug for other conditions should not stop taking the medication without consulting a doctor. Treating the rising.
Very strange, guys, because I've always given it to my kids and my ex as a fever breaker. You alternate ibuprofen with Tylenol to break the fever in children, especially. Very strange. Personally, I can't take ibuprofen. I went into it in my other video. You'll have to watch the part 1, 2, and 3. But I just thought I would show you. Here we go. It's popping up. Strange. And we'll hit this and a couple other things and we're done.
The number of COVID-19 cases will put immense pressure on our healthcare system. And that's why you've been hearing the term flatten the curve. The goal is to do what we can to limit transmission ourselves so we don't overwhelm our hospitals and medical workers. Doctors are bracing for a surge in patients, but many hospitals were already operating at capacity before this. Eric Sorensen reports.
Humber River Valley is one of Canada's newest hospitals, as ready as any to treat the outbreak of COVID-19. But this hospital and others can only take in what they can. Italy has a top-notch healthcare system too, and it was simply overwhelmed.
Our hospital systems in Ontario and in Canada routinely run at 100% or higher. So any surge outside of our normal activity gets us into trouble. If we take the worst case scenarios, kind of like what's happening in Italy right now, we could vastly overwhelm our hospital's ability to care for everybody, especially our intensive care units.
1 month ago, there were 8 cases in this country. A week ago, there were 96. Look at how the numbers have jumped upward since then. Over the last 4 days, cases more than doubled to 597 Tuesday night. At that pace, doubling quickly, there could be 30,000 cases 1 month from now, and that is a conservative estimate. With the numbers rising then, the worry is the healthcare system's capacity. There are only so many ICUs and ventilators. If the numbers spike beyond capacity, there may not be enough facilities and care for everyone before the pandemic breaks. With precautions like social distancing, the curve flattens. Cases.
Don't you believe it, guys, as far as this social distancing BS? You know, yeah, it'll help a little, but you remember the numbers they just showed you? Go back, rewind, watch again. The 30,000, that's coming. Not to scare, fear porn or anything, that's coming. So get ready for that. Number 1. Number 2, they're hiding stuff from us so much right now. I'll try to bring you everything I can, but they know this thing is out of control like a runaway train. With that, I want to bring you something else. Remember we covered it where Trudeau was not going to shut the border just yesterday? Look what happened today. What a difference a day makes. 24 little hours.
Can rise more slowly, can be managed over time, and Canadians can.
Medication recommendation: what COVID-19 patients should avoid.
Global National with Donna Friesen. Reporting tonight, Robin Gill.
Good evening and thank you for joining us. We begin with drastic new measures to slow the spread of COVID-19 and help Canadians get through the pandemic. The Canada-US border is now being shut down to non-essential travel as officials on both sides scramble to fight off the virus. Here at home, disruptions are growing by the day, and so is the financial fallout. Today, the federal government unveiled a massive $82 billion aid package to help Canadians cope.
In these extraordinary times, our government is taking extraordinary measures. In Canada, public health should never hinge on financial considerations.
Coming up, we break down the numbers, what the government is promising, and what's in it to help you. But first, the latest from the front lines. Quebec recorded its first death today. That brings the total number of deaths in Canada to 9. More than 700 people have now tested positive in Canada. Most of the cases are in BC, Ontario, Alberta, and Quebec. BC saw a major spike today, 45 new cases, bringing the total to 231. Ontario, Alberta, and Quebec all reported double-digit increases. Elsewhere in Canada, here's where the numbers stand at this hour.
We start to see a sharp rise in cases, and a number of provinces have reported cases with no links to travel. This is a signal that there is some degree of community spread, so our time to act is now.
All the provinces are ramping up their response to the outbreak. Just today, Newfoundland and Labrador and the Northwest Territories declared public health emergencies. In BC and Saskatchewan, provincial states of emergency are now in place. A lot has changed in this country in just 1 week, and officials say it won't be over anytime soon. Here's Mike Armstrong with how the government plans to help.
The Prime Minister was beaten to the punch just an hour before Justin Trudeau stepped out of self-isolation to announce the historic closure of the Canada-US border. The US President took to Twitter, Donald Trump tweeting out that the two countries had agreed to shut down the border to non-essential traffic.
Travelers will no longer be permitted to cross the border for recreation and tourism.
Now, there is a concerted effort by both governments to ensure commercial trade continues to flow. Truckers, for example, are exempt. When the U.S. closed its border to China and then later to Europe, it did so unilaterally and without warning. The closure with Canada was negotiated and mutual. Keeping supply lines open is too important to both countries.
There was not even an atom, a molecule of pushback on that.
The other major announcement was the COVID-19 Economic Response Plan. There are two parts. There's $27 billion in direct support to Canadians and $55 billion in tax deferrals. Together, that's about 3% of the country's GDP and a massive dent in the federal budget.
Usually my job is to ensure that we maintain our fiscal track. But right now, as Minister of Finance, my only job is to make sure that Canadians can keep food in the fridge.
Now, the goal is to help the people who need it most. There's an emergency care benefit for people who don't have access to paid leave. That's about $10 billion. There's a program to help workers who lose their job in this crisis, $5 billion. There's also a temporary business wage subsidy, $3.8 billion to incentivize employers to keep workers on their payroll. There's also support for student loans, Indigenous communities, and homeless shelters. Now, Ottawa's moving the deadline for Canadians to file their taxes. Instead of April 30th, it's now June 1st. And there's also some relief coming for people nervous about paying mortgages. The country's 6 biggest banks have agreed to allow personal and small business customers that have to defer mortgage payments for up to 6 months. Robin?
Mike Armstrong.
Did you hear that? Defer mortgage payments 6 months. The USA needs to follow with that immediately. That's what we've been talking about. One of the things, you guys. See, different countries are stepping up. Where the hell is the United States?
In Ottawa. Thanks, Mike. The emergency fund is aimed at helping Canadians pay for groceries and rent and to help businesses meet their payroll. Abigail Beeman shows us who's eligible and how Canadians can access the aid.
This Ottawa bookstore closed its doors but is shipping out care packages.
They say if they like mystery books or fiction, history, whatever, and we have a surprise package and we drop it off at their place.
But the owner still had to put their dozen staff on leave and have had trouble getting through by phone to the right government agencies for EI help. Others report the Service Canada website is crashing as they try to sign up.
Anything would help, for sure.
Two major planks of the government plan are the emergency care benefit and the emergency support benefit. The care benefit is short-term help for those without paid sick leave, parents with kids out of school, caregivers for the sick, and people under quarantine. The government says people will be eligible for up to $450 a week
Holy
for 15
crap.
weeks, starting in April. You can apply through Service Canada, the CRA, or a toll-free number that hasn't been released yet.
Did you hear that? That's double what Trump is doing. Damn, Canadian, Canada, yo, Canada. Well, I can say for you people up in Canada, man, you better jump on the wagon, man. As soon as you can apply, get on it. Because you know what? That money's going to go quick, brothers and sisters. And as for U.S., Trump, loosen up those damn purse chains. You're giving out how many trillion to the damn banks and the damn stock market? We are the forgotten people, you idiot, Mr. T. You're going to lose us if you don't open the purse strings. Just my 2 cents worth.
Will require a simple attestation that will not require medical documentation. We want this to be as easy as possible.
The emergency support benefit is longer-term help for Canadians who lose their jobs or hours due to COVID-19 but aren't eligible for EI. Details are still coming about how to apply. And for 12 million low and modest income families, there's a boost to the Canada Child Benefit and a one-time goods and services tax credit. Ottawa says these two measures combined would amount to $1,500 for a single parent with 2 children. The top-ups will come to you automatically from the CRA based on last year's filings. There's also a temporary payroll subsidy for small employers, equal to 10% of pay, up to $25,000 per business. And all of this is a start.
I will highlight, of course, that the Emergency Measures Act is a significant step, not one that we feel we need today, but not one that we are closing the door to in the future if necessary.
The Prime Minister considering every option in a rapidly evolving.
Well, as long as we're on this, let's see what Mr. T has to say. Mr. T at his finest. Here we go.
There's always a bit of a building delay, but I want to play for you an exchange at the White House briefing today. We'll talk about it on the other side.
Why do you keep calling this the Chinese virus? There are reports of dozens of...
Hold on. Let me get this right, girl. It's the Wuhan 19 coronavirus. The Wuhan. Because it came from China, woman. It came from China. Look at that snobby little blankety blank booger-nosed girl. That's just rude. And look at Mr. T. Poor Mr. T over there. Ha! Okay, here we go. Guns loaded.
Incidents of bias against Chinese Americans in this country. Why do you keep using this? A lot of people say it's racist.
It's not racist at all. No, not at all.
A person at the White House used the term Kung flu. My question is...
And it's not aimed at China people over here, guys. Give me a break. Remember what we're trying to do? Team 99. The 99%. These guys are still digging at the president. Leave him alone. Let him get to where he can sign some more money for us.
Do you think that's wrong? Kung flu. And do you think
Kung
using
flu?
the term Chinese virus, that puts Asian Americans at risk, that people might target them?
No, not at all. I think they probably would agree with it 100%. It comes from China.
Ian, what are we doing here?
Oh my God. No, we're not. I can't do it to you guys. I just cannot do it to you. Because I know what's going to come out of their mouths. Let's check out this. More Mr. T. Go, Mr. T.
I want to show you again tonight, usually known as the crossroads of the world, Times Square in New York. Tonight, desolate again. Very few pedestrians, very few cars at the height of the coronavirus scare. Well,
we know where the police are in New York, don't we, guys? There's more police on that street than there is anybody else. And look, there's nobody walking. I see like 2 people, 3, 4 in New York. Are you kidding me? This shows you how nutty it's gonna get Wuhan special real fast, guys.
Good evening once again. Day 1154 of the Trump administration, 230 days until the presidential election. And it's been 1 week since the World Health Organization declared the coronavirus a pandemic. The number of confirmed cases in our country is going up fast. Tonight, it reaches over 8,600 people. Note it has been nearly 2 months since the first case was diagnosed in this country, as you see 140 total fatalities. As the nation grapples with increasing shutdowns, the president has now adopted a new stance when it comes to positioning his effort to fight this pandemic.
Consider America to be on a wartime footing in terms of fighting this virus?
I look at it, I view it as in a sense, a wartime president.
Okay, I went into it on some of the other videos, guys. You can correct me if I'm wrong, but I'm not in some ways. Once we call active emergency, that's one thing. When we initiate it to the next level and call it wartime, what that means is this gentleman that you're seeing in front of you that said something about the election, there will be no election. You cannot change a presidency in a time of war, whether it be World War I, World War II, or a severe, basically act of war situation. You're welcome to look into it, but that even gives the president, a second-term president, can become a third, even a fourth-term president as long as there is a war. For instance, World War III was to enact, there would be no elections. And this is a bio war. I'm throwing it at you guys. I want to hear your response. I kind of looked into it myself, and it's called the Wartime Act, I believe. But, I mean, it's kind of crazy, but it's the way it is, guys. So let me know what you think. Let's watch a minute more, and I'll sign out.
While he may view himself and wish to be viewed as a wartime president now, the problem with that is the lengths that he has gone to diminish the virus, the danger, and the approaching pandemic.
We're finding very little problem, very little problem. Now, you treat this like a flu. It's going to disappear. One day it's like a miracle. It will disappear. The Democrats are...
Remember, I told you I was going to bring you guys in fairness, both sides of the coin, and I've done it in my last videos just to be fair and show non-bias, because I think we need to know both sides. But again, I urge everybody to throw away the hatred and the anger and become Team 99. Because again, these newscasters are part of the 1%. They don't care. They just soon everybody fights. They get to make more trouble, like you're going to hear.
Politicizing the coronavirus. This is their new hoax. Anybody that needs a test gets a test. They're there. They have the tests. The tests are all perfect. Like the letter was perfect. The transcription was perfect. It will go away. Just stay calm.
Today, Trump invoked the Korean War-era Defense Production Act, which allows him to order businesses to make ventilators and masks for healthcare workers, as well as other critically needed medical supplies.
And that's part of the War Act that I was talking about, guys. And, you know, as much as I do want you guys to understand one thing, I don't believe either side knows what they're getting into as far as the one world order. But the one world order is, I believe, starting up is what we're going to see. As I said in my other videos, you got right now Pelosi and the left and the right singing Ring Around the Rosie together, hugging almost, which is estranged. 60 days ago, you would have never thought it would be this way. You still have some hatred from the newscasters because they're bent out of shape. And that is always going to be. There's going to be those haters out there. I urge everybody to just get over it. Let's get it together, brothers and sisters. We're in this together. And we're not just in this to fight the Wuhan 19 monster plague. We're in this to fight what's coming. And it's much worse than the Wuhan. Is the one world order agenda, guys. And it's not a joke. With that, I'm going to let you think on everything. I love you. Feel free to send me your input. And remember, healthcare sucks. Over and out, my friends.